hundreds of members of the dialysis community. I spoke with patients receiving care at the major dialysis companies and current and past employees of those companies. Nephrologists, nurses, dialysis technicians, social workers, psychologists, and dietitians. I interviewed patients at smaller dialysis firms and university medical centers, some of whom dialyzed at home. I consulted attorneys, economists, union leaders, experts in healthcare policy, as well as nephrologists and nurses in several countries outside the U.S. Gradually, a disturbing picture of American dialysis came into focus. Before publication, I shared passages from my book with a number of organizations, private and public, whose activities I had described. These included the dialysis companies DaVita, Fresenius, and Satellite, as well as the Mid-Atlantic Nephrology Associates, a group of dialysis providers in the Baltimore area. I also sent excerpts to the federal healthcare agency known as Centers for Medicare and Medicaid Services, CMS, the dialysis oversight body called the ESRD Networks, the Washington University School of Medicine, and Tenet Healthcare. Most of these organizations either did not respond or chose not to comment. A few organizations did answer, however, and one, DaVita, replied at great length. I have referenced some of DaVita's specific responses in the text of my book. However, it seems useful to summarize here the business principles according to which, DaVita spokespeople told me, their company operates. Principles which, they said, rendered many of my assertions incorrect or downright impossible. 1. DaVita states that patient welfare is paramount in its facilities. The first consideration in every decision we make is patient safety. We are committed to providing a comfortable therapeutic treatment environment for all patients. 2. DaVita claims that involuntary discharges of patients from their dialysis clinics are a rare event. In the event such a discharge becomes necessary due to patient behavior, we are committed to supporting the patient's continuity of care and operating within the guidelines that CMS tightly monitors and governs. 3. DaVita maintains that the dialysis industry is strictly regulated by CMS, the ESRD networks, and state health care surveyors, whose various standards of care DaVita meets or exceeds. 4. DaVita says that all aspects of care provided at its facilities are determined not by DaVita itself, but by the independent physicians who visit patients there, write treatment orders, and decide whether to offer treatment in the first place. As a dialysis provider, we do not make decisions about the duration or other parameters of any given patient's dialysis treatments. 5. DaVita claims that it treats all patients equally, whether their care is funded by private insurance or by a government program like Medicare. The services we provide, how we bill for them, and the reimbursement rate are specified either by the government or in our contracts with our health insurance partners. 6. DaVita stresses its leadership in the industry. We remain a clinical leader in the government's two key performance programs, the Centers for Medicare and Medicaid Services, CMS, 5-star quality rating system, and the Quality Incentive Program, QIP. 7. DaVita does not comment on the circumstances of individual patients due to patient privacy concerns. This, in brief, is how the company characterized its operations and values. My book draws a picture of dialysis in America that is often very different, and casts the rise of corporate dialysis as a cautionary tale about for-profit medicine as a whole. 2. The Inner Sea. When a lobe-finned fish, the gilled and scaly ancestor of all terrestrial vertebrates, first hauled itself up onto the muddy bank of a Devonian stream some 375 million years ago, it carried within itself a pool of primordial sea.